I'm Dr. Margaret Nickel, and I'm going to talk a little bit about Pap testing. Patients frequently ask me, why have the recommendations on Pap testing changed, or why have they suddenly changed? And it's important to know that we have really known that Pap testing did not need to be done every year since the 1980s. The first studies that showed this were done in the 1980s. And as OBGYNs, we were a little bit slow. I was a little bit slow to adopt this because we didn't trust it, and we were concerned that our patients would not come in if they didn't get a Pap test. However, since 2002, American College of OBGYN finally in 2002 changed their recommendations to say that a Pap test should be done every 3 years. Now, they've been modified and changed just a little bit since 2002. The latest recommendations came out from ACOG in 2012, and the recommended or the preferred method for women over 30 is to have a Pap and an HPV test no oftener than every 5 years. And the reason that the HPV, it's important to know that HPV is so important in cervical cancer that if you don't have HPV, you're not going to have cancer. Of course, nothing is 100%, but it's near 100%. The association between HPV and cervical cancer is near 100%. For women under 30, so many of them will be positive for HPV that we don't do HPV testing as a routine in this group. We do use HPV testing to triage or tell us which women need follow-up from a borderline Pap and which women can be followed up just with routine Pap screening. For women under 21, it's all the national organizations that make recommendations on Pap testing recommend against doing Pap tests for women under 21. And the reason for that is that cervical cancer is a rare disease in women under 21, and really any screening test is not helpful for rare diseases. Of course, if a woman under 21, or in fact a woman of any age, has symptoms of abnormal discharge or bleeding, these symptoms should be evaluated. In fact, screening tests only apply to normal women of average risk who have no symptoms.